Yesterday's paper tells us that depression is the second most disabling medical condition in Australia behind back pain. So the size of the challenge is significant. It was obvious to us that new and significant change that could take place in relation to prevention of mental illness would occur because large numbers of people were exposed to the positive psychology thinking and research that was put forward by Professor Seligman. We knew that exposure to large numbers of people would be important. I'm happy to tell you that this residency attracted more participation than ever before in the Thinkers program, with over 9,000 people taking part in Seligman events and conferences. I would now like to introduce the Honourable Jay Weatherill, the Premier of South Australia, to launch the report. Thank you, Premier.
Well, this is indeed the launch of the Building a State of Wellbeing, a strategy for South Australia, the final report of our Adelaide Thinker in Residence, Professor Martin Seligman. In a way, well-being is the ultimate goal of all that public policy is directed to. And so, in a fundamental way, it's really what all of our efforts are directed at. And so to choose that as the objective of public policy really just allows us to collapse everything that we seek to do, whether it's about our health services, our education services, our law and order services, all of the aesthetic pleasures we get from our sporting and cultural pursuits, all collapses down into one simple idea. So it's wonderful today that we've chosen this as such a clear-sighted and obvious objective for our endeavours. And anybody that's listened to Professor Seligman, I think, has been struck by how inspirational his message is, and it's an incredibly liberating message, and one that I think is going to unlock a lot of energy here in South Australia. And I think a testament to the strength of his message is the coalition of support that he's built in South Australia across such a broad range of institutions, public and private, across a range of disciplines, in a way which I think is incredibly powerful. This report considers how positive psychology can improve the lives of everyday South Australians. The report explores the potential to use positive psychology in schools, workplaces, and across the whole of our community. Wellbeing should be considered as the principal measure through which we can understand the state of our economy and our society. Economic indicators just simply don't provide an adequate explanation as to the progress of our society. And we also know that positive mental health and wellbeing is fundamental to productive lives. So there's a massive interplay between the prosperity of our community and the health and wellbeing of our citizens. Our government believes that bringing greater happiness and enhancing wellbeing is the fundamental project for government. And Professor Seligman has challenged us to become the first jurisdiction in the world to measure wellbeing and to embed its importance in our culture. And in his report, he suggests three principal strategies: positioning South Australia as a world-leading state of wellbeing, measuring wellbeing, and teaching and building and embedding wellbeing science in South Australia. And I'm happy to announce that our initial response is to dedicate $800,000 over the next 4 years to measure and build wellbeing in South Australian young people. We want to increase wellbeing and improve the resilience of our young people in order for them to cope in this challenging world. This funding will assist us to support Lake Windermere, Salisbury High School, Trinity College, Holy Family, Mount Oliphant College, John Hartley School, Swallowcliff Primary School, and to join Mount Barker High School as community wellbeing hubs. A pilot wellbeing research survey will be expanded to 175 schools. The SAMRI, Institute of Mind and Brain Theme, will undertake more research on the wellbeing of young people. Work will be undertaken with universities to increase the breadth and number of courses in positive psychology for teachers and other professionals. And the public, independent and Catholic education sectors will work together to drive wellbeing measurement in our schools. So the final report that I'm launching today is a summary of Professor Seligman's ideas, his proposition that South Australia could be the world's first state of wellbeing. The accompanying summary of progress outlines the significant work which is unfolding and evolving in South Australia, led by many different partners in the residency, and it's a compelling story. In his report, Professor Seligman has left us with more than a blueprint for action. He's suggested a paradigm shift in the way in which we see all public policy, not just mental health policy. This work will enhance our well-being, begins now. We have the opportunity to embrace these concepts of positive emotion, engagements, relationship, meaning and accomplishment to build a more inclusive, more resilient, happier South Australia. So thank you, all of you, for your commitment, and I encourage you all to take a copy of this wonderful report and also the summary of the progress that we've made today. Thank you very much.
As the Premier mentioned, the proposition of building well-being at a genuine scale in South Australia is a very exciting one. I've said in a number of my recent speeches that I consider creating in South Australia a demonstration of well-being and resilience to be one of the top 10 key initiatives for our state's future development. And this exciting program has very tangible impact on our economy. Mental illness is devastating to families and communities and is extremely costly to society and to our businesses. 1 in 4 young people suffer from mental illness, and in Australia we lose over 9 million working days, for example, per annum to young men with mental illness. By way of context, to illustrate the importance of this now, I believe that this decade, the one we're in, has the potential to be viewed by future generations looking back as the most transformative decade of the 21st century. Now, obviously, we can leave our state's transformation to chance, and who knows, we may get lucky. Or we can make a choice and decide to seize this moment by working together across the state to do what's necessary to put in place the foundation for the framework of the new South Australia. And this initiative is one of those very key frameworks. And in my capacity as both Chair of the Economic Development Board and Chair of the SAMRI, and indeed Chair of Scotch College, I'm very interested in how to build resilient, confident and healthy people, and especially young people who are going to be the key to this 21st century, to make a contribution to this state, because I think that's what is going to help us to seize the moment or to make the choice that we have before us. That future in the state that we're in is in a period of dramatic change. And I guess nothing illustrates that more than the change in, for example, our manufacturing economy, where the challenges of our total economy is to just continue to find ways to constantly move up the value chain and to add value at all levels in order that we maintain our competitive advantage and can seize the possibilities that are before us, particularly in our very strong markets to the north. And I think that the science of positive psychology gives us an innovative toolbox to craft a new literacy for our young people and indeed for all people in the state. And so as in South Australia we move to aggressively build more knowledge-based industries, and I think the biomedical precinct to which the Premier referred with the SAMRI, the new Royal Adelaide Hospital, in the future, the Women's and Children's Hospital, the university medical schools and research centres, and what we believe will be the cluster of new biomedical institutions that will take root around that, is an example of the creation of a hub or a campus which will have potentially well over 15,000 staff, students and world-leading researchers all focused in one area, and that dynamic needs to get repeated over and over again in the state. But speaking for the SAMRI, where my bias has already been declared, we are very keen to link the well-being strategy given to us by Professor Seligman to the work of the SAMRI, and are going to house that obviously in the mind and brain theme under the leadership of Professor Giulio Lucinio, who's here. because we think that this prevention approach to well-being and building mental health makes sense in the continuum of research about depression and mental illness, that it requires, as we guess we would say in business, addressing the whole value chain, not independent parts of it independently. So what Martin proposes, as you heard, is that South Australia translates the latest positive psychology science into action. And translates is the key word here. And he really believes and has challenged us, and it's a huge challenge, that we can be the first state in the world to do this. And so do I, and I hope you do as well. And we have leaders from across this state in sport, architecture, agriculture, aged care, business, local government and health, all poised to take this work more broadly across the state. And I really hope that each of you in this room will continue to support this work, which has attracted so much support already, and that together we can find ways to grow, fund and launch a Wellbeing Institute in South Australia, inside of the SAMRI, to lead this work into the future. We are actively looking for partners from all sectors, business, universities, philanthropy, to make this happen. You know, I look forward to your continued involvement, to seeing you at events with Professor Seligman and General Cornum in February. And think about this. If South Australia becomes the state of well-being, it will be the 100-year game changer for our state.